I'm so happy to be hosting our first AML event of 2025. And I thought, what a great way to start this new year that talking about nutrition. And today we will have two masters of the topic, Francesca Castro and Peter Adintori. Both are experts in oncology nutrition, and they will provide practical, science-based strategies to help you manage nutrition-related side effects of AML treatment and transplant. So today we will learn how to address these nutrition challenges and fuel our recovery as we embark on the new year with healthier nutrition. So let me take a moment to introduce our amazing speakers. I'm so excited to have them both here with us. So Francesca Castro is a level 3 research clinical dietitian nutritionist at Memorial Sloan Kettering Cancer Center, where she joined the myeloma service in 2021 under no other than Dr. Urvi Shah to focus on dietary interventional clinical trials. Francesca has a Master of Science in Nutrition and Exercise Psychology and a Bachelor of Science in Biomedical Science. Her interests include the impact of dietary choices on both cancer prevention and progression, gastrointestinal microbiome, and evidence-based clinical nutrition care. And during her free time, she likes to try new recipes and go to the park with her dog. Listen closely, Rigatoni. I just love that name. So welcome to Francesca. And we are also going to have here Peter Adintori. He is a board-certified advanced practice dietitian with additional board-certified specialties in oncology and nutrition support. Peter cares for patients with leukemia and myeloma on the inpatient services at Memorial Sloan Kettering Cancer Center. Prior to this role, Peter was a research dietitian on the blood and marrow transplant service, also at MSK. He is also a PhD student in rehabilitation science at NYU, where he studies the role of nutrition, physical function, and mental health in patients living with and beyond cancer, specializing in blood cancer. So welcome both. And now I will turn this time to our speakers.
Thank you, Mary Lou. Let me share my screen quickly. Oh, 1 second.
No worries. We are seeing your screen, but not the slides. Yeah, now we can see them.
Sorry about that. Okay, thank you, Mary Lou, for the wonderful introduction. I'll get right into it. Here's an outline of what we're going to go over today. Just a brief overview of nutrition during treatment, and then also dietary recommendations for risk reduction and survivorship, a little bit of nutrition myth busting, and then some key takeaways. I have no disclosures, and these are Peter's disclosures, which do not affect the content of today's talk. So getting right into overview of nutrition, I just wanted to lay the groundwork for everyone, indicating that nutrition plays an integral role in many different processes in the body, including human metabolism, microbiome, and how dietary exposures affect our health. And then nutrition research, which I am involved in, and so is Peter, lays the foundation of these evidence-based nutrition recommendations that you might hear from a dietitian or physician or another allied healthcare professional. And then this is a nice graphic just summarizing what systems in the body that nutrition plays a role in. And then here are some potential dietary mechanisms. This is a paper that Dr. Shah, who I work with, wrote with Dr. Iyengar, kind of laying a potential mechanism into where a whole food plant-based diet might affect cancer risk reduction and cancer reduction. And then this is also a mechanism on how diet can potentially affect the microbiome. I'm not going to spend too much time on this, but if anyone has any questions, please feel free to ask them in the Q&A section. And now I'm going to pass it over to Peter, who's going to cover nutrition during cancer treatment.
Thank you so much, and excited to be here with everybody. So, um, really, we could probably spend hours and hours and hours talking about this, and there's so many ways to really boil it down. But these are some general recommendations, and what I'll say is everybody's experience going through treatment is different. So it's really important to make sure you're in close communication with your healthcare team when you're going through cancer treatment, because some of these symptoms you may not experience, and you may not have the same experience as someone else that has the same exact type of cancer and has the same exact type of treatment, right? So everybody's experience treatment is different. But in general, the goals that we have during cancer treatment itself are to minimize how much weight loss we may have, which can happen for a variety of reasons. We want to practice good food safety, especially when our immune system is a little bit less strong than it has been in the past. Typically, when we're going through chemotherapy, that can happen. I have some major symptoms that we tend to see commonly in our patients, and so sort of how to address those. And then one of the most important things I think is really to make sure that throughout the process of cancer, you're protecting the relationship that you have with food and your body in general, because there may be things that change in both those areas. And there's a really big importance on making sure that you're kind to yourself throughout this process. Francesca, you can advance. Okay. So for minimizing weight loss, as I said, this can happen for a variety of reasons, right? You may lose your appetite in general. Going through cancer treatment is stressful, right? So when folks are stressed, a lot of the time your appetite just goes away. There's also many other reasons that your appetite can go down. And that can also be related to the way things taste or the way the experience of eating is. You may have symptoms in your gut, which I'll talk about in a little bit in a few slides further. You may also just be fatigued and have low energy for both physical and mental health reasons. And as I said before, you may have more stress or changes in your mental health as a result to going through a really traumatic process of cancer treatment, right? Nobody wants to experience cancer. And unfortunately, when that does happen, it's really stressful. So we want to make sure that we're able to honor the fact that that stress and that mental health itself can affect our appetite and our intake of food directly. So one of the things you'll hear a lot of dietitians say to you is small, frequent meals. And really what that looks like is trying to move your mind away from needing a really big breakfast, lunch, and dinner, which is sort of, from childhood where a lot of folks living in the US are conditioned, right? That's sort of the way we structure our meals. What I like to encourage my patients to do is really have smaller meals because they tend to be tolerated a little bit better, and just having them a little bit more frequently, right? Because if you go from 3 large meals to 3 small meals, that's much less food than normal. So you just want to make sure that you're having something every couple of hours, right? Every 3 to 4 hours is usually what I tell patients. And it doesn't have to be anything grand, right? It can be a small amount of something, emphasizing both calories and protein as a major piece of nutrition that will help really fuel that body of yours and keep you nice and strong throughout treatment. Also, it's really important to kind of reframe the idea of healthfulness, right? Because we know that it's difficult to go through treatment in general, and sometimes if you've ever been sick, having a cold, even something as simple as a cold, the things you're gravitating towards aren't a large, robust salad full of all the fruits and veggies you can think of, right? That doesn't exactly feel the most appetizing. You may be going more for comfort foods or things that feel a little bit more gentler on your belly, and maybe those won't be the most quote unquote healthy things that you can eat. And what I always tell my patients is give yourself grace. That's time. This is the time to do it, right? We want you to be able to reach for things that feel okay in your stomach. They hold down, they don't give you more nausea, and they can really help keep your body nice and fueled. So strong, the ability for you to go through treatment is a little bit more smooth. I'm always a big advocate for just being gentle with yourself and moving your body as able, right? Movement can really, really help with your appetite, and it can really help with just feeling well overall. But we also know that movement may look different going through the cancer treatment process than it would prior to going through cancer treatment. So that's where you work closely with your healthcare team to make sure that the movement you're deciding to do is safe, and then also that you feel okay doing that. You can progress, Francesca. So the second piece, which is a little bit scary for some people to talk about is food safety, right? So we know that during cancer treatment of a variety of different types can really affect our immune system, right? So we may be anxious that if we're out in public, we might get a cold or the flu or COVID or some other issue, right? But we also have to be concerned that maybe we might get a foodborne illness if we eat foods that are not quite as safe, right? And so we have a higher risk of infection where, I sort of in a somewhat comedic way tell my patients that if I were to have a foodborne illness, I would be on the toilet for 2 days and have a really awful time. If someone going through cancer treatment has a foodborne illness, they may really need to be hospitalized and have a much harder time recovering from that, right? And so we really want to prevent that by practicing good food safety. And we could, again, give a very long talk just on this. What I will say is we have some really great resources at Memorial Sloan Kettering. So if you just Google Memorial Sloan Kettering and food safety, you'll get, there's an interview that I've done with a couple of the other dietitians from our center. We have some patient education materials that are open access. And so those are really great for you as a place to get some general information. And these are the 4 topics here. So cooking foods and making sure they're cooked to the right internal temperature, keeping foods cold when they should be cold. So defrosting things in the fridge rather than on the counter or in the sink, which I know I did all throughout childhood and I know my parents did. So something where you want to be a little bit more cautious. Separating your cutting boards or things where you're cutting, fruits and vegetables on are different than what you're cutting, meats and dairy or seafood on, just in case there's any contamination there. And then just making sure you're cleaning your hands well. And then the last rule of thumb I tend to tell my patients is that if you have leftovers, to really use them within 2 days if possible. And especially during these winter months, if we're cooking things like soups or stews that are really big and you say, Peter, there's absolutely no way I can eat a pot of soup in 2 days, I wouldn't expect you to. What I encourage folks to do is freeze some of that portions and individual portions and put them into the freezer. And at that point, those are really pausing that 2-day window, right? So then when you move it from the freezer into the refrigerator, you now have a fresh 2 days to be able to have that soup or that stew or whatever it is that may be in the freezer. Francesca, you can advance. So just to touch on briefly some of these symptoms, and I'm more than happy to answer questions that may come up about these things, is, I try to categorize these symptoms into things that either make it difficult to eat enough food, things that make you afraid to really eat anything at all, and it's just really nerve-wracking to have food, and things that make the eating process a little bit less enjoyable than we're used to. And really what I like to put on the bottom here is that these symptoms are personal to your experience. So someone's experience with nausea may be very different than someone else's experience. The same with, any gas or bloating. Certain patients tell me, oh, it's fine, I'll just deal with it. And other people are like, I don't want to eat anything. I feel like everything's going to make me bloated, right? So that's absolutely okay in both directions, right? I always like to individualize my recommendations to what a patient really tells me is necessary for them. You can go forward. So for when it's hard to eat enough, right? This can be our appetite is low, or we eat a couple bites of food and we feel really full really quickly, or maybe it's painful, right? So things may not feel so good going down our throat when we're swallowing, or our mouth may not feel great, whether it's dry or it might feel, it might feel painful. And so these are just some tips here, and I know you'll have the slides after, so I don't want to read these to you directly. But really what I like to emphasize here, and something we use frequently in our practice in the hospital, is the use of smoothies or milkshakes or oral nutrition supplements as needed in order to really supplement what we're able to get in through solid foods, right? And the reason this is helpful, and I can tell you, having worked with patients with cancer, having worked with professional athletes and recreational athletes, it's really, really easy to get a good amount of calories into a smoothie or a milkshake, right? And a lot of times it's easier for someone, while they may not be feeling so hungry, to take a couple sips of something that we know gives them a good amount of calories and protein. And that can just be something that, alleviates some of that stress and that burden of the eating process, right? Because if you think about preparing something that's liquid, it's a little bit more quick than something that you have to cook and chop and heat and all of those things, right? The sort of getting from the fridge into your mouth is a little bit more quick and convenient for you. And again, these are things that are really helpful when it comes to whether you're feeling full quickly or whether you have no appetite. And then when your mouth or throat pain is there, I would say generally people tend to lean on things that are a little bit softer, or again, liquids, and going for things that are more bland, right? Because things that are spicy or really spiced or really smelly, can really change the symptoms that people have. And so it sometimes is easier to have things that are just a little bit more boring in this time, right? To be able to kind of lean on those and save yourself from the stress of having something that maybe would make your symptoms a little bit more troubling. Francesca, you can go forward. Okay, so now when you're afraid to eat anything, right? I will not understate that this is extremely challenging, right? Always when you're having a lot of nausea or diarrhea or bloating and gas, the last thing you want to do is roll the dice and try something, right? Because you don't want to have another episode of nausea or another episode of vomiting or another, really difficult bowel movement. And so this is exactly where I tell folks, just be gentle with yourself and take it one meal at a time. You'll hear me say that a couple times. And I think that's a really important thing to remind yourself, right? Say you wake up in the morning and breakfast goes really poorly or really well, it doesn't mean the rest of the day is either shot or that it's going to be a smooth sailing day, right? We take it one meal at a time and reassess how we're feeling and see what we're open to trying at that point. A big thing with nausea and vomiting, which is probably one of the most common symptoms I deal with in the hospital, I will say something that is, I think, really important. And I will tell you when I see patients for their transplant and they've already had a couple courses of treatment for leukemia, they wish that I told them this back when they started their treatment for leukemia, is just really when you're feeling nauseous, try to avoid any food that you would be scared to not eat for a long time. So whether it's your partner's cooking, if you're someone who isn't a big cook, but maybe your partner is, or family, or food that you really love. Like here being in New York City, I can tell you the amount of patients tell me that they ate pizza when they were nauseous and now they haven't had pizza in 2 years. It can be really troubling, right? We don't want to have reasons why foods we enjoy are now more difficult to enjoy. So this is where, you can have foods that are more bland and things that you don't care, right? If people eat oatmeal, they're like, oh, I could never look at oatmeal again and I'm fine with that, right? Things that really people are okay with throwing away. Now with diarrhea, we really want to make sure we stay nice and hydrated, including electrolytes in our beverages as best we can to really replete what we're losing in that in those bowel movements. When you think about bowel movements that are really liquidy, you tend to lose a lot of water and important nutrients in that, right? So if you're in the hospital, that's when people tend to have, IV fluids and things like that. Whereas when you're home, you may just be able to kind of give yourself some quote unquote super water by putting in some electrolytes in there to really give yourself some repletion, right, from any of those loose bowel movements you may have. And then with gas and bloating, it's difficult to sometimes find the source of that. There are some medications that can be really useful to support that, or to support those symptoms. And so talking with your doctor about what you're currently experiencing is important. And if you have access to a dietitian at your cancer center where you're being treated, it's really important to talk to them too, right? Because sometimes these things may be related to food and sometimes they may not. But just talking to somebody who can work through that with you can sometimes really make a big difference in being able to choose foods without as much fear. And then the last thing I'll say here that is important is the straw use, which seems odd to people, is, when you're feeling that upper belly bloating, so maybe you're feeling more burpy and you're just feeling that fullness, sometimes you're sucking in some air with that drinking of a beverage. And cancer treatment for a lot of reasons can make food just empty out of our bellies a little bit more slowly than usual. And so when we limit that straw usage, we're not taking in quite as much of that air. And same thing with carbonated beverages, is we can get some of that air built up in there and it kind of just gets stuck. And so it can be really uncomfortable for people. So if you find that you're getting this gas and bloating and you're using straws with your beverages, you can just hold off on them for the time being. So that way you're not having a continued experience with that. Okay, you can go forward. All right. And lastly, there's many reasons why eating may not be so enjoyable. So with taste changes, it's really weird when things just taste different, right? Or they taste bad. Like something that you're used to eating can really be difficult to sort of describe to people why something is tasting odd. Again, if you're seeing a dietitian, I think it's really important to just describe this to them as best as you can, right? A well-trained dietitian will be able to sort of ask the right questions to get that out of you and sort of better understand exactly what that pattern may be. It's really helpful to bounce those ideas off someone because, I can tell you with many years of experience that sometimes I can pinpoint the exact ingredient that's bothering someone and figure out some suggestions of what to adjust rather than, just say, oh, avoid this whole group of foods because they're clearly giving you an issue, right? And the opposite is helpful with certain tastes, right? So if things are really sweet, then you can go for things that are more salty. And if things are really salty, then you can go for things that are more sweet. They sort of offset each other in a nice way. Same thing can go for bitter and sour. And then if you're having an experience where foods just don't taste good at all, and there's sort of like that cardboard taste, that can often be connected to your dry mouth as well. So if you're feeling that dry mouth, there's lots of rinses you can do, as well as sort of making sure that you're having foods with sauces or gravies, or taking sips of beverages in between your bites to really keep that mouth as wet as possible. That really allows you to detect those tastes. The other tip that I tend to give here is if people are really having a hard time tasting their foods, I recommend that they, if someone's preparing foods for them, that someone prepares their food with a little bit more spice or a little bit more salt or things like that to just kind of amp up the flavor a bit. And something that to me may taste way too salty or way too spiced or way too sour. Could be totally fine for someone that's going through treatment and has a harder time tasting things, right? Where I would say, oh, I can't believe you can eat that. And they would say, well, it tastes great to me. And that's all that matters, right? Is that you can taste it and it tastes well. And then lastly, it's really important to recognize that feelings of depression can happen during treatment at any point, right? And that's totally normal and expected. And it's important to recognize that you have space to talk to people about that, whether it be your providers, your family, your caregivers, your loved ones, whomever it is that you feel comfortable speaking with. And I always tell people, especially if you're in the hospital while you're getting treatment, is to set up a special area in the room where you might be eating, right? So that way that's your dedicated space to eat and you can make that an enjoyable experience as best as possible, right? So a lot of the time in the hospital, that looks like a chair at bedside with a table set up, rather than having the food in the bed itself, if possible. And the same thing can go for home, right? If there's a special table in your kitchen that you can eat at, or a place in your home or apartment where you can eat something, that's great. And I'm a big fan of using other types of media to really boost your mood while you're eating, right? So whether that be some, enjoyable music in the background, or, a television program or something that allows you to really have sort of a positive environment while you're eating, it can help really associate that experience with something a little bit more enjoyable, even though the eating itself may be a little bit more challenging. And as I said, I can talk about this all day long, so I'm happy to sort of go through symptoms later if needed. But as I said, your experience is your own here, and advocate for yourself and your needs, right? These are so personal. So if you're on a certain medication for your nausea and it's not working, tell your doctor, tell your nurse practitioner, or your physician's assistant, or your nurse, or your dietitian, or whomever it is that you're speaking with, that, hey, I don't think this is really working. Can we try something else, right? There's so many options on the market that we have as clinicians to really help patients. And so we don't know, what a patient needs unless folks advocate for themselves. And so I always encourage my patients to be their strongest voice and really just speak up when you feel like things are not necessarily in the right place, and things are not so comfortable for you. I've already said the one meal at a time. And as I said, small, frequent meals, high in calories and protein will never do you wrong. It's something that I think is really beneficial for you, especially during treatment. And obviously I'm biased, but talk to a dietitian if you can. I think we can be extremely helpful for folks, whether they speak to you in person or over telemedicine or phone. At your cancer center, I'm hoping there is at least one dietitian that you can speak with. And if not, they can hopefully connect you with someone that can support you in some way. You can go forward. And then the last, and again, one of the more important things I think is that we should really protect our relationship with our body and with food, right? These things may change during cancer treatment just by the virtue of having a difficult time eating and a difficult time moving. And just the cancer treatment process itself can really change the way our body looks and feels. And we know that food is just one tool for health. And in the takeaways slide, I'll really show you what I mean by that. But really recognize that it's not all about just what you eat, right? It's all the different things that you can do as something that's under your control while going through cancer treatment. You can really invest in your wellness, throughout that process. And we'll talk about that at the end. The other thing is to recognize these symptoms may feel like they're going to last forever, but they won't, right? That's the one thing that I think is really important to remember, is that there is sort of a sort of other side of that unfortunate experience, that these symptoms will go away. And so having these strategies of staying as nourished as you can and moving as well as you can will do really well by you going forward. And then being gentle with yourself, right? Patients always tell me, oh, I'm so discouraged. I'm not eating enough. And I always tell them, I'm not coming in here to tell you to eat more or to force you to do anything. I'm just here to hold space to really support you however I can. And so, my patients always laugh when they see that I am not as hard on them as they are on themselves. And so recognize that, as gentle as you are on yourself is we're all here to support. And so recognizing that it's really these small changes and these small, things that we're able to put into our bodies and the small movements we're able to do can really make a big difference in the big picture. Okay, you can go forward. I think it might be back to Francesca after. Yeah.
And now I'm going to talk about dietary pattern for cancer risk reduction and survivorship, and where the evidence lies for risk reduction and survivorship. So this is a really great matrix from the World Cancer Research Fund outlining some of the evidence that we have for cancer prevention and survivorship. The highlighted red here is just to highlight what areas are to limit or eat in moderation. And then there is the green here, areas to increase. Again, this looks different for everyone. And I'll talk about making feasible goals for yourself in this space and really trying to individualize the recommendations to yourself. So the recommendations state to include more plant-based foods. That includes fruits and vegetables. Eating a variety is important. Nuts, seeds, and beans, plant-based sources of protein, as well as whole grains and plant-based oils. Including more daily movement, as Peter mentioned, what works for you and what feels good for your body. And of course, speaking to your healthcare team to see what movement is feasible for you. And movement that you enjoy, I think, is the most important thing. A lot of the research you might see, oh, running's the best form of movement, walking's the best form of movement. If you like to dance or you like to garden, those are also forms of movement, and do what feels truest to yourself and what you actually enjoy doing and can do over time. And then limiting red and processed meat. American Institute of Cancer Research has a lot of resources revolving this if you're curious, and we can answer questions at the end. But substituting those red and processed meats for lean meats like poultry, eggs, fish, and plant-based proteins, and reducing and limiting highly processed foods. So those are foods high in sugars, sodium, and saturated fats, which also include sugar-sweetened beverages. So substituting water and low-calorie beverages as much as possible, such as seltzers, unsweetened iced tea, a little lemon and water, that sort of thing. And then also limiting alcohol consumption, and then limiting supplements and vitamins unless medically appropriate and recommended by someone on your care team. So you might be wondering, with these recommendations, where should I start? Tips to consider are considering individual goals, right? Thinking about, what do you eat for breakfast, and what is one thing that you can add to the plate to maybe make it a little bit more nutritious? I'm a big advocate for what you can add to the plate instead of thinking about everything you can remove from the plate, and starting with potentially easiest swaps. If you know you really enjoy a black bean burger from time to time, maybe considering swapping out once a week a beef burger for a black bean burger. Again, do what you enjoy and what feels right for you. And then with fiber, you might notice that a lot of the recommendations are plant forward, and it's important to slowly opt for higher fiber items. And with anything, don't do everything at once and really work slowly in meeting your goals. And then, of course, as Peter mentioned, working with a registered dietitian for your individual needs is important, and they can help you go through your diet and figure out what goals are the most feasible and what most makes sense, especially when it comes to while you're in treatment and when you're post-treatment as well. And then this is the World Cancer Research Fund and American Institute of Cancer Research that I mentioned. They have a lot of information on cancer type, risk factors, and overall just general recommendation. Remember that a lot of this data is based on associations, not causations. It's a lot of epidemiological data, so looking at a subset of patients and looking at when they or if they develop cancer, and then comparing that to their dietary intake. So there is a lot of research still to be done out there in terms of nutrition and cancer and risk reduction and survivorship. So just keep that in mind when you're reading some of this material. And then these are additional resources as well. And then AICR also has a lot of nice goal setting checklists and resources on what you can do to help prevent and reduce risk reduction. So this is a nice 30-day checklist, and they have a small goal for every single day, and they are feasible, and you can always alter some of these goals to make sense for you. And then we wanted to just highlight some nutrition myth busting that are commonly asked questions, especially when it comes to nutrition and cancer. So one of the questions that I get asked the most is, does sugar feed cancer? The answer is no. Sugar is a necessary fuel for the body, and there is no single food, including sugar, that can cause cancer itself. With that being said, there is strong evidence to suggest a diet in low added sugar is potentially helpful and lowers the risk and overall and increases overall health. That does not mean that you have to avoid it completely, but it does mean that you can be aware of nutrition labels and think about, the composition of your plate. And I just wanted to note, added sugar does not include naturally occurring sugar that's found in fruits and vegetables. And if you look at like oatmeal, has a little bit of naturally occurring sugar. And then, do I need to eat organic? Again, this is something I get asked all the time. You do not need to eat organic to reap the benefits of a plant-forward diet. Currently, there's no evidence to suggest that organic foods are more nutritious. There's this really nice website called Safe Fruits and Veggies to kind of show you how much fruits and vegetables you would need to consume in a single day to have potential consequence from pesticides. But there is evidence that eating a variety of fruits and vegetables can reduce cancer risks and related outcomes. However, with that being said, if organic food is something that helps you and encourages you to eat fruits and veggies, and if that's within your budget, then by all means, eat organic. And then another question I get is, do I need animal protein to meet my needs? Animal protein is more bioavailable than plant protein, but you can still get adequate amount from plant proteins and do what works best for you. If you can tolerate animal protein better, then eat animal protein and focus on maybe incorporating more fruits and veggies in the diet. If you want to transition to a more plant-forward diet and try different plant-based proteins, there is enough protein in plant-based food, and I included this nice graphic kind of summarizing some of the highest forms of plant-based protein. And then I just wanted to note, you'll see soy foods are here. Soy foods are also another common question that I didn't add on the slide, but I wanted to touch on really briefly. Currently, evidence suggests that soy has no effect on cancer risk or progression, and soy actually can be beneficial and might have a protective effect. And we can answer any questions at the end. And I'm passing it back over to Peter for key takeaways, so we have ample time for questions.
All right, so to bring it home, I'm gonna just bring it one more slide. Okay, so as a reminder, the right dietary pattern for you is the one that works best for you, right? This is not what works best for someone you spoke with that went through treatment 3 years ago, or your friend or your loved one, or whatever it is, right? This is sort of your own experience and your own process. And so generally what I tend to tell folks is that when something is a pattern that works well for you, it feels balanced, right? It feels like you can have both healthful foods and foods that are maybe not as healthful, but are rich in other ways, right? Maybe they're foods that are celebratory, or foods that are, making you feel really good in the moment, and maybe aren't so healthy, but they really are meeting your needs at that point, right? Being gentle to yourself is really important, as I've said, something that you can also do consistently. So this isn't something where you're like, all right, Peter, I can follow this type of diet for 1 week and the next week I'm getting rid of it because it's February and I'm over it. And this was just a month of January activity, right? I have many friends that are doing dry January, right? Like alleviating alcohol this month, and then they're going to go back to binge drinking next month, right? So how helpful is that? We know it's not very helpful, right? We want to do something that we can do long term, right? And so that's something that we can be consistent with. And also it's something that's personalized, right? Everyone comes from a different background and culture and has their own experiences with food that are really personal to them, right? There's an ingredient that you know that you either love to cook with or that your family has cooked with ever since you were a child and you really enjoy that. We can find a way to include that in your diet, right? And we can really find a way to make sure that that is working for you. And so that's really, really important. I've always said one meal at a time. That's something I always share with my patients. And then the last thing I want to share here is this wheel or plate or whatever you want to call this circular graphic here, but it's from the American College of Lifestyle Medicine. And as you can see, this green triangle with the apple on the top left here is demonstrating that diet is one component, but we can see also movement or physical activity, stress management, forming and maintaining healthful relationships with others, improving your sleep, and then avoiding risky substances like drugs and alcohol can really help with overall how we feel, right? So a lot of the time when patients are telling me, Peter, I'm having a really, really hard time with eating, we'll hold space to talk about that. And then I'll say, okay, now tell me what's going well. And they'll be like, well, I'm sleeping 10 hours a night. And I'm also, really trying to minimize my stress. And I'm really enjoying music, or I'm really enjoying this show, or I'm really, talking with my loved ones every day. I try to really empathize for folks that certain things may be going really well when other things are really challenging. So finding that balance and being able to kind of think about the big picture can be really useful instead of really getting down on yourself and emphasizing that one thing may be really hard at that point. So with that, I think that's the last piece, Francesca, is that right?
Yes, that's the last piece. We
Okay.
have a few additional resources in here that will be shared when Mary Lou shares the slides, but just for sake of time, we wanted to hold space for questions. So these are in the slides that will be shared at the end.
Yeah, so thank you. You can see now my screen, I guess, right? So great. So thank you both, Francesca and Peter. That was way great informative presentation, and what a great way to learn from nutrition, and just not nutrition, about everything. And it's time now for the discussion part of today's webinar. So if you have any questions about nutrition or how to manage related side effects or anything Francesca or Peter spoke on today, now is your chance to ask your question. This time is specifically set aside for community members to have a chance to talk to our incredible presenters. So feel free to ask your questions if you have any. Just as a reminder, you can ask a question or make a comment by typing it in the chat box, or by raising your hand if you would like to ask your question verbally. You've raising your hand when you are called on, you can unmute yourself and ask your questions. In the meantime, we get questions from the audience. I do wonder, with all this technology around us, and especially with so many information around, how can AML patients distinguish between reliable nutrition advice and misinformation, especially when looking for resources online, friends, family, or even in social media?
Yeah, I will say, and Francesca, please feel free to chime in if you have anything else to add. I would say that is extremely challenging, right? So I am constantly asked, what do you think about this? What do you think about that? Depending on something someone has read, right? And that's great because people are asking questions and they're curious, right? I think again, biased answer that I will give is that if you're confused or you're not sure, talk to your healthcare providers, right? A lot of physicians, your doctor, your oncologist may not know a lot about nutrition, but they may know a really great dietitian that works with them that they can refer you to. We really try to understand the research and the evidence behind recommendations we give, and not necessarily grabbing onto what one article may say or one piece of media may say, right? That being said, there's general recommendations. So if you look for big governmental organizations like the American Institute for Cancer Research, the National Institutes of Health, or NIH, the American Cancer Society, those guidelines and recommendations and resources tend to be provided by researchers and healthcare providers that are really closely monitoring the content that's coming out, right? So they go through sort of like a quality check, if you will. Many things you'll see on social media don't necessarily have that same, check in balance, if you will. And so sometimes the content that gets through there is not necessarily the most valuable or the most reliable. And I would say the same goes for things like documentaries and all of that that are really, really enticing and really motivating, but can also be sharing one type of story with you, whether it be really the truth or not. Francesca, anything you want to add to that?
No, I think you made great points. I also wanted just to add, I did do about a year ago a talk with the nutrition and myeloma chapter on how to interpret nutrition research just in general, and I think that's on YouTube. And it's a full hour talk on interpreting nutrition research, specifically in the media more so than by word of mouth.
Thank you. Yeah, totally. And I think on these days, it's hard to keep up with information. So it's good to have good information. We had someone sharing in the chat. I want to share with everyone that they believe that was a great advice. The one that mentioned Peter a few minutes ago, he said that was a great advice that I never thought about avoiding foods you like when you're experiencing nausea. When I was having my bone marrow transplant at MSK 6 years ago, my husband encouraged me to order the shrimp scampi for dinner. I immediately vomited after 2 forkfuls. I couldn't eat shrimp scampi again for 3 years. So thanks again for sharing. Let's see if we have more questions. In the meantime, a few patients that were not able to attend live send me their questions. So one said, my specialist is thinking on transplants. So I wonder, what are the most important dietary considerations to support my recovery and overall well-being? Also between like before recovery and after, during, etc.
Yeah, so I would definitely say going into the transplant, it tends to be a pretty intensive chemotherapy prior to starting transplant. So it really depends on the regimen that someone's given, the treatment that they're given by their doctor. Going into that process, I think a lot of the tips that I've given here do apply, right? So having that small frequent meals, trying your best to just eat as well as you can and move as well as you can throughout the process. I've used the analogy of sort of from physics, which is a body in motion stays in motion. So, it's a lot easier to keep moving and keep eating than it is to kind of pick yourself up and start doing those things when you haven't been doing it for quite some time. And so that can be a really good thing to kind of keep in mind. And I would just say, again, be gentle with yourself throughout the process. It can be really daunting and difficult to go through a transplant, especially when your immune system is low and you have really low energy because your blood counts are really low. And so, again, sort of just taking it one step at a time, one day at a time is really important. And I will say in general, for folks that have already finished treatment and you're sort of in that, what we would call survivorship phase, the recommendations really say that you should follow to the best of your ability, following the risk reduction guidelines. So things like including more plants, like Francesca mentioned, trying to limit, artificial or added sugars, things like that. Those are beneficial things to do if you feel like that's feasible for you in that time, right? Again, the experience is your own. And so if you feel like you're not quite ready to follow those things, then don't feel any pressure to do that, right? We want you to feel nourished and to feel well throughout the process. And so these things can be really small changes and really start from somewhere.
Thank you. There's one that maybe was mentioned when Francesca explained about organic, but they said like, what practical tips can you share for maintaining nutritious diet on a tight budget, especially when certain healthy foods can be expensive or hard to access? Same with fresh products. And what are the best options when talking about frozen on canned food to maintain a balanced diet?
Great question. I was going to actually mention canned and frozen food. They're just as nutritious and oftentimes are packaged at peak nutrition instead of sitting there and having to go through transportation. Do what works best for your budget. buying it on sale and then even freezing it yourself for later use is also a really good tip. And then some of the plant-based proteins are actually tend to be a little cheaper sometimes than animal-based proteins. So stocking up on those and they're shelf stable is a really good way to kind of be budget friendly. And then yeah, Peter, do you have anything else to add?
No, I think that was great.
Awesome. There's another thing, I don't think we mentioned it, but what considerations should patients keep in mind when thinking about starting probiotics during their treatment or recovery?
Yeah, that's a great question. And both Francesca and I have done research on the microbiome, and it's something that people are really interested in. And I think that's great, right? There's a lot that we have to learn about the microbiome and a lot that we can do. And what I'll say is I generally discourage patients from taking probiotics for a lot of reasons. One, especially when our immune system is low, it can be extremely dangerous to take probiotics. And so if your immune system is not optimized, which of course with a cancer diagnosis and with any treatment, it is not in the best shape possible. It can be really dangerous to take probiotics. And so that's one piece. And then the other piece is that the actual use of probiotics to sort of help the microbiome is not always very helpful. It can actually be harmful in a lot of ways. So if you take antibiotics, for example, for something, and then you think, oh, I'll take the probiotics to offset it, that doesn't necessarily do what we think it does, right? And I would lastly say the ones that are on the market that you may get in the pharmacy and things are not exactly the most effective at doing what they think they do. So I usually tell folks to stay away from them and include instead a variety of probiotic rich foods and prebiotics as well, which are the foods from that are it sort of fuels those bugs in your gut. And so those are really great things. And you can always see if you just Google like a list of probiotic rich foods or prebiotic rich foods, you can kind of find some pretty good information on there. And you can include those things in your diet without any risk.
Yeah, I think it is hard when people think that that's like something that you can take without hesitation and there's not going to be much trouble, but it has. So thank you for clarifying that. I don't know if Francesca wanted to add something extra.
No, nothing to add. I'm very big on what Peter said, doing a food first approach and thinking about what you can add to your diet from whole foods.
Thank you. Thank you. So we have another question in the chat. So we spoke a lot about from the patient side of you, but how a caregiver or a loved one best support AML patients in meeting their nutritional needs. And sometimes starting is easy, but what about on a long-term process?
Yeah, I think the importance of caregivers being gentle on themselves is just as important, if not even more important than for the patient, right? We all are very sensitive to the fact that going through cancer treatment as a patient is extremely scary and daunting, and it can be just as scary and daunting for folks that love that person, right? And we often don't want to say, well, what about me or anything like that, right? So firstly, I would say take care of yourself as a caregiver, and make sure you're connected with any resources you possibly can. There's so many great caregiver support networks and things like that. I know our cancer center has one specifically for cancer center or for patients who are primary caregivers for patients. We have a really great caregiver support group that really folks can just share what's going on, what's working, what's challenging. So that's more so a general tip. But what I would say in relation to nutrition is just have that openness and that open discussion, right? Where you're not pressuring someone to eat a certain way. It's the same way that I practice as a clinician is just sort of ask what someone needs and how you can best support them, right? Even when I'm working with patients, I always, this seems small, but it can make a big difference, is instead of saying, do you have any questions or do you need anything, which someone can respond with, no, I'm okay, thank you, right? What I say is, what can I do to support you? What do you need from me right now? What questions do you have? What's on your mind, right? Because that opens the door in a different way for someone to share with you that something may be, that your support may be needed or helpful. They can't just say no. They'll say, oh, I guess I would really help with, I'd really like your help with this, right? And, if you feel like they maybe aren't open to sharing, say, what can I do for you with preparing your food, or what can I do with helping you with groceries, or what sorts of things may you be interested in eating, right? So sort of asking more pointed questions may open the door for someone to kind of share a little bit more openly with what they're open to, right? And just being kind and thoughtful in that is helpful. And I know it can be really frustrating because you want to see someone eat just as much as we do. Because being nourished, we know is going to help someone feel nice and strong throughout treatment.
Yeah, that's great. So thank you. Thank you a lot. I think that's the time we had for questions. So I thank you both. That was an amazing presentation. I learned a lot. So again, thank you. And before we go, I wanted to highlight the perks of connecting your records in HealthTree CureHub. Having a HealthTree CureHub account allows you to connect all your health records from any facility into one single profile. Once your records are connected, you can now view a comprehensive overview of your medical history, including diagnosis, genetic labs, results, and treatments, all within a single user-friendly interface. It takes only a few minutes to create the connection and start taking control of your diagnosis. You can also explore and learn more about your genetic information and help researchers find answers to key questions by filling out their surveys and studies. On the screen, I have the link to sign in for HealthTree CureHub, along with the email address of our amazing patient navigators who are available to help you create an account and connect your records. I will also include information about how to enroll HealthTree CureHub in our follow-up email, so look out for there too. And just to finish this amazing event, let me tell you more about our upcoming events. So Mary and I are very excited about the program we've put together for 2025. This year, we've taken your feedback into account to shape the content of this program. And we encourage you to keep sharing your suggestions, questions, or topics that you would like to know more about. And we look forward to creating more events that address what truly matters to you. So on March, we're gonna hear from Dr. Hari Erba about testings in genetic testings, why this matters to AML care. In May, we're gonna learn about hospice, understanding what truly is and what it isn't for AML patients. We also have some exciting events in the planning process for February, so you can watch out in the upcoming newsletter for the announcement and registration page for those events. I am really excited about these webinars and our amazing speakers, and I would love to see you all at these upcoming events. Just as a reminder, we would appreciate a lot if you take 2 to 3 minutes to fill out a brief survey about your experience today. Zoom will prompt you to take it as soon as you leave this event, and you can submit any topic ideas through this survey. As always, I would like to thank our sponsors, without whom this would not have been possible. So thank you, Abby and Kura Oncologist. And finally, I want to say again, thank you all for helping us build our AML community. I've added my email to this slide. Please do not hesitate to reach out to me. You can even just say hello, or you can have any topic suggestions that you would like to see us cover. And I will be happy to help you if you have any questions about HealthTree or our programs. I appreciate you all, and I hope you have a great rest of your day. Once again, thank you, Francesca and Peter, and I hope to see each one of you in another webinar soon. Goodbye, everyone.